This is a community analysis of the city of Gainesville, Florida. Alachua County was founded in 1824. Being a part of the Arredondo Grant, it extended from southern Georgia to the Tampa Bay. By the year 1860, the county had roughly a population of 8,000, of which 232 inhabited Gainesville, the seat of the county. Gainesville was originally meant to be called Hogtown, but later was named for Seminole Indian War General Edmund P. Gaines. The city served as a Confederate commissary during the Civil War, growing in population and economic status through its vegetable and citrus crop and cotton export. At the end of the Civil War, Gainesville began to rely more heavily on phosphate mining and lumber industries. With this shift, Gainesville experienced major economic growth. This booming economy saw the establishment of two schools, the Union Academy for African Americans and the East Florida Seminary School for whites. As the nation neared the end of the Reconstruction in 1877, Alachua County boasted over 18,000 residents, and Gainesville's population had increased by 600% to 1,400 citizens. In 1905, the East Florida Seminary School was renamed the University of Florida and has remained one of the predominant economic strongholds in Gainesville for over 150 years. At present, the United States Census Bureau shows that Gainesville is home to over half of Alachua County's population with 354 citizens. At 63 square miles, this makes Gainesville one of Florida's most citizen-dense communities with over 2,000 people per square mile. 52,000 of these citizens are UF students that matriculate annually. Today, Gainesville's educational, cultural, health, and social resources are largely due to the University of Florida. There are over 60 centers of spiritual and religious worship within the city of Gainesville. While the predominant portion of these are, in fact, Christian centers, there are also a number of Jewish, Islamic, Buddhist, and non-denominational centers. Several of these offer community outreach and support to the infirmed, the elderly, and the underprivileged. UF is a major structural support to the city of Gainesville, not only in the consistent economic stimulation, but also in its provision of education and employment opportunities, and as a purveyor of varying healthcare resources. Additionally, university research in both health and science are markedly beneficial for not only the local but global populations. As a society with a diverse and student-heavy population, there are an abundance of culturally enriching opportunities, including a performing arts center, arts museums, planetarium, a zoo, community lectures, and several outdoor festivals. There are nearly 60,000 housing units in the city of Gainesville. About 20,000 of those housing units are owner-occupied. 10,000 units are currently listed as vacant, while the remaining 30,000 include a multitude of student housing options, as well as standard rental properties for families and professionals. Gainesville has several resources available to its homeless population. The range of immediate housing options include halfway houses, women's and men's transitional housing, and even an organized outdoor pavilion camping area. There are also soup kitchens, clothing assistance, free medical and mental health clinics, and job assistance made available. Traffic in the city of Gainesville is nothing short of hazardous, with continuous construction performed on all of the major roads, including I-75. Shifting traffic patterns are an issue. Regular fluctuation in the population is due heavily to the influx and exodus of students annually. What the community needs at this point to maintain safety is adequate street lighting, additional sidewalk rails, and alarming and signaling crosswalks to maintain the safety of pedestrians and bicyclers. As might be expected with a college town, there is a significant amount of diversity, including religious, ethnic, political, racial, and ideological. The population is heavily comprised of healthcare professionals, college faculty, and undergrad and graduate students. And while the majority of those over the age of 25 are considered to have an income over the poverty level, there is a significant disparity in the community. According to the United States Census Bureau, nearly 40% of the Gainesville population lives below the poverty line, earning less than $25,000. 4% of the population is unemployed, and almost 14% are receiving some type of public assistance. A large segment of the population consists of college students, and with that comes health concerns for those behaviors of individuals 25 years and younger. Research has shown that college students are more likely to engage in binge drinking and risky behaviors which lead to unintentional injury far more often than their older adult counterparts. Additionally, with the condemnation of the old-fashioned cigarettes, vaping pens, which often contain nicotine anyway, have crept in amongst young adults, and smokeless tobacco stores are on the rise. Gainesville is a mecca of healthcare in the state of Florida. There are 8 hospitals within city limits. 6 of these are branches of the U.S. Shands Hospital Network. The remaining 2 are the HCA-affiliated North Florida Regional Medical Center and the Malcolm Randall VA Medical Center. All 3 hospital systems do have emergency departments. UF Health Shands, however, is a Level 1 trauma facility, a NCC magnet destination, and a renowned transplant center. There are over 30 clinics and urgent care centers in the Gainesville area, including both pediatric and women's health-specific clinics. There are innumerable private practices and specialists. Gainesville is also home to over a dozen psychiatric and substance abuse facilities, including inpatient rehabilitation centers. In addition to all of the aforementioned resources, Gainesville has an abundance of independent living, assisted living, long-term acute care, memory care, and hospice facilities, as well as home health care options. Some relevant Healthy People 2020 objections are the reduction rate of chlamydia infections. The goal is to see a 10% decrease. Alachua County has seen an increase in the infection rates annually. Reduction of the proportion of persons living in poverty. The national average in 2010 was 15.1%. In 2018, Gainesville's percentage of those living below poverty level increased by 5% to 39.7%. Unemployment, however, decreased from 9.3% to 4.4%. Reduction in the use of smokeless tobacco products by adults. The percentage of students in Florida using e-cigarettes or other tobacco products has actually increased by 3% in the last 3 years since the revision of this objective. Gainesville has a rich abundance of well-maintained parks, running trails, and bike paths, including 3 state parks, 5 community gardens, 9 tot lots, 3 public pools, 29 neighborhood parks, and 20 nature parks. Gainesville has an ordinance which mandates that all commercial properties recycle. That includes apartments and condominiums within the city limits. Orange and blue recycling bins, go Gators, are given to the residential neighborhood dwellings. Driving around the local neighborhoods, however, it is easy to see that these bins are desperately underused. Public Works does offer reliable services, but when taking into account old, outdated buildings with ineffective insulation, their inefficient use of energy may be driving up costs unnecessarily. Police often fail to uphold ordinances requiring pedestrians and bicyclists to stay in their designated areas. More enforcement might lessen the number of accidents and injury. Gainesville is governed by City Commission, led by Lauren Poe, the current mayor, and made up of 6 additional commissioners. The commission is fairly easily accessed. There are bi-monthly public forums held, with community participation heavily encouraged. Additionally, they may be reached via their offices, the city website, or on social media. There is a relatively equal distribution of the city budget, with 61% being disseminated amongst Gainesville law enforcement, fire control, road and street facilities, and parks and recreation. In 2018, it was announced that in efforts to lessen the fire department response time, the City Commission approved a $1.9 million grant for them to hire 17 additional firefighters. Some pertinent community health diagnoses include risk for ineffective tissue perfusion related to decreased cardiac output. Poor eating habits, inactivity, and smoking have kept heart disease as the second leading cause of death in Alachua County for over a decade, currently attributed to 17.5% of deaths. Risk for impaired gas exchange related to alveolar and capillary membrane changes. The percentage of students in Florida using e-cigarettes and other tobacco products has increased by 3% in the last 3 years. Risk for infection related to risky sexual behaviors. The rate of chlamydia continues to increase each year in Alachua County. In 2018, Alachua County had the second highest rate of transmission in Florida. Over 90% of polled UF students have reported that they use no barrier protection during oral sex. Risk for injury related to risk-prone behaviors. In Alachua County, 6.2% of the deaths are attributed to unintentional injuries. Studies have shown that young adults are more likely to disregard their personal safety and engage in risk-taking that results in injury more often than their older adult counterparts. Risk for ineffective health maintenance related to alcohol abuse. Nearly 30% of UF students report heavy and binge drinking on a regular basis, 1 to 4 days a week. Annually, 1,800 undergraduate students die in alcohol-related incidences. Risk for inefficient cerebral tissue perfusion related to interruption of blood flow. Strokes were listed as Alachua County's 4th leading cause of death, accounting for 5.2% of all deaths within the county. While completing my windshield survey and researching the university polling and studies, there are many behaviors witnessed in the city that can increase an individual's risk for stroke. Alcohol abuse, obesity, unhealthy diet. There are many fast food and other unhealthy food options all throughout the city. Tobacco use and physical inactivity.